Hello and welcome to another edition of Tuesdays with Liz, a disability policy for all. Today we had the great fortune to be talking to Adriane Griffen, who is the Director of Public Health here at AUCD, and we'll be talking about health, and she'll be explaining about why health matters to everyone. So welcome, Adriane.
Thanks, Liz. It's great to be here. Really excited to talk with you.
Okay. The first question is, I understand that there is a toolkit for public health for everyone. And can you tell the audience what is in the toolkit and why should people use it?
Okay, good. Well, thanks for asking that. We're really trying to create a movement in the public health world to make sure that people with disabilities are part of every project, every program from the planning stages, not like an afterthought of, oops, I forgot about people with disabilities in my community, but from the beginning, very beginning stages, part of everything. So with this toolkit that you refer to, that's the Public Health is for Everyone toolkit, that was really just our initial step, our very first step. What we're aiming to do is make sure that the existing public health workforce has the tools at their fingertips on how to make sure people with disabilities have what they need in terms of nutrition information, physical activity, any area of health disparity, so tobacco's in there, and making sure that the actual structures are accessible, that people with disabilities are able to get access to health screenings, and just like everyone else, go to the doctor, get those exams, just like everyone else.
Okay, thank you. And one of my favorite saying, and I love the saying, anything that fits so well in your project is nothing about me without me.
Absolutely, yeah. I mean, what we're trying to do is make sure that people with disabilities are on the radar for public health practitioners, and that they think, all right, people with disabilities are an important demographic group in my community, and I need to make sure I'm serving them and including them.
Okay, thanks. The next question is, can you ask another project that I have noticed you work on is the Act Early program?
Yeah.
And can you explain to our audience about that program?
Sure. So Act Early is short for Learn the Signs, Act Early, and really it's about making sure that parents, child care providers, and health providers are doing developmental monitoring when children are young. So making sure they're hitting their milestones in terms of when they are learning to talk, when they're starting to learn their words, and things like that. So with the Act Early program, we actually have an opportunity to educate the parents, these early child care providers, and health professionals to make sure they're doing the developmental monitoring, but then if they notice something is a little off track, making sure that that child gets into services, because we know the earlier a child gets into services, the better off they are over their lifetime. And the other thing that I always like to remind people is that if you're a child with a disability, someday you will be an adult with a disability, and you need access to care and services just like everyone else. So that's really about what Act Early is about for me.
That's so great.
Mm-hmm. The other thing I'd like to mention too is that I also am the Helping Children champion for the Friends of the National Center on Birth Defects and Developmental Disability. So I also make sure that the Act Early message is mixed into the public health messaging when we're using other campaigns, just making sure that it's on the radar, to have a lifespan perspective, not to just check it off the list. We saw that kid, they got the monitoring, and then maybe the education system will look after them. But it's important that they're tracked and followed and connected across their whole life with whatever they need.
Okay, thank you. You mentioned about their friends, Can you explain to our audience about the Friends?
Sure. So the Friends is a national coalition to support CDC in all of their disability work. So it's a very broad coalition. We have about 470 or so group members, either they're organizations or individuals who care about living well with a disability and making sure that they have access to healthcare and public health services and programs.
And what is CCD?
So CDC stands for the Centers for Disease Prevention. I'm sorry, I'm getting that acronym wrong. It's Centers for Disease Control and Prevention. So it really should be CDCP, but a few years ago they added a tagline to add in prevention. And so for people with disabilities, I really like to make sure that it means things like getting your flu shot. You know, people with disabilities need flu shots just like everybody else. So the center at CDC that pays attention to the disability perspective is NCB-DDD.
Okay, great. Is there anything else that you would like to share with the audience that I missed?
Yeah, well, I just wanted to do a plug. A few of us who had been working on the 6x15 early childhood goal did a spin-off effort, and we put together a commentary that's going to come out in a couple weeks in pediatrics, basically around the idea that children with disabilities need to be connected with services sooner rather than later, and that in this country we're really approaching, and we are at, I believe, a capacity crisis where we've identified some children and then the wait lists are just far too long for them to get into services, and they're not getting access to the programs that they need. So this commentary is coming out in pediatrics in early November, and along with that we're going to do an Act Early chat. So I would love to do a plug for that for any of the viewers who are on social media. They could join us. It's actually, I have a little sign. Could I do my little ad now?
Right.
All right,
Thanks.
so it's November 9th, 2 p.m. Eastern Time, and it's going to be hashtag Act Early, and we will be tweeting from AUCD News. And I wanted to give a shout out to the March of Dimes. They're going to be at MOD Health Talk. They are co-sponsoring it. And then I also wanted to give a shout out to our Public Health is for Everyone handle on Twitter. And that's PH is the number 4 and then the word everyone all together. So join us and really let your voice be heard and make sure that health and public health really is for everyone across their lifespan.
Because if you don't understand about health, how can you get better?
Right, exactly. And I think, health is the underpinning for everything else we do. If you're not healthy, you're not really going to be able to get as full quality an education as you would have otherwise.
Yeah.
And if you don't have your quality education, then that's going to hinder employment opportunities for you later down the line. So I look at health as being very fundamental for everything else we do.
Okay.
Yeah.
Thank you.
Thank you. I appreciate it.
And if you have any questions about this or any other policy issues, please go to the AUCD webpage and look for this week's In Brief. And if you have any questions about this edition of Tuesdays with Liz, please leave them in the space below. Thank you again,
Thank you.
Adriane.
Appreciate
Bye.
it.